Now, if you're not measuring your case acceptance, you have no idea how you're doing. So I might suggest that you start measuring it, because it's been said by Peter Drucker, the founder of the science of business management. Two things he said about measuring. Number one, things that are measured improve. Things that are measured improve. Do you believe that, Naren?
Absolutely. If you don't measure it, I mean, there's no way. It's like, you have no leg to stand on. There's nothing to improve on because, you don't know
You
what
don't know
to
how you're doing.
improve. Yeah.
It's all a happy accident,
Yeah,
or a sad
exactly.
accident. Either way, it could go either way.
Yeah.
The other thing Peter Drucker said is you can't manage what you don't measure. And doctors that don't measure their case acceptance will typically respond, "Hey, George, how do you think you're doing with case acceptance?" Or Dr. Maria, how do you think you're doing with case acceptance? They'll usually answer that question anecdotally. Dr. Maria might say, "Well, Gary, I had 2 new patients today. Both of them needed treatment and both of them scheduled for it. So I think I'm doing pretty well." Or conversely, Dr. Maria might say, "Gary, I had 2 new patients today. Both of them needed treatment that is absolutely in our practice wheelhouse, and neither one of them scheduled. I don't think I'm doing very well." So neither one of those perceptions is accurate because it's called immediacy and recency. The concept in psychology of immediacy and recency means we remember what happened most recent. Disproportionately, it's always this or it's always that. Oh, well, we had 2 patients today and they accepted, so we're doing great. Oh, we had 2 patients today, neither one of them scheduled, so we're doing horrible. Neither one of those is accurate. It's not a long enough lens to look at. So start measuring this. All right, now I want to share with you. So that was kind of a way to get into looking at some data and looking at how you might improve. And remember what Peter Drucker said: things that are measured improve, and you can't manage what you don't measure. With that in mind, let me share a simple tip for you. I need to kind of set it up. Let's assume that it's an older patient, someone say 60 years old or older, and I'm just randomly picking a number there. And there's a lot going on in that patient's mouth. Clearly, over time, a lot of different dentistry has been done. There's a lot of things going on in the mouth. Nothing hurts, but clearly that patient could benefit from some complex restorative dentistry. Naren, you've worked with a lot of practices. What I'm describing is something that I think is not uncommon for any of our listeners. Would you agree?
Agreed.
Yeah. So now, doctor, and now imagine that because you're a relationship, I'm going to weave some concepts together here. So now we have the patient, a lot going on in their mouth, but nothing hurts. And now, because we're a relationship-driven practice, even as a new patient, we know a little bit about that patient because that's part of the new patient experience. We know a little bit about them. And let's just say, hypothetically, that your patient, George, I'll use George as the name, the fictitious name in this example. Let's just say that he's recently moved to the area to be closer to his grandkids. And that came up in the discussion. That's why he's a new patient in your practice, because he moved to the area and found your practice. Again, I'm just making up an example. So now put those two concepts together. Here's George, 60 plus, a lot going on in his mouth, nothing hurts. And he's recently moved to the area to be closer to the grandkids. So now doctor is going to say something like this. George, it's been great to meet you today. I sure appreciate you choosing our office for your care. We're going to work hard to take great care of you. We've taken some records today. We've taken some x-rays. We've taken some images. We've taken some three-dimensional images as well. And I've also had a chance to talk to you about kind of a little bit about your dental history. Now, it's apparent to me, and likely to you too as well, George, that there's a lot going on in your mouth. But before I present a treatment plan, I'd like to ask you a question. Is that okay? And
Yes.
What's George going to say?
Absolutely. Mm-hmm.
And now I'm going to apply the information that he just gave. George, you mentioned that you've recently moved to our area to be closer to your grandchildren. Now, it's been a while since I've moved, but I remember the last time I moved, there were a lot of moving pieces in my life. And so the question I have for you, in light of the fact that there's a lot going on in your mouth, is now the right time to address the solutions ideally to get to an ideal oral health, especially given the the timing, and given the fact that, hey, you've recently moved here, is now the right time to address these conditions ideally? And then I shut up and listen. Is now the right time? And it could be, again, another example. Let's say it's a younger patient. Bob, you mentioned that you just started a new job. It's been a long time since I started a new job, but I remember the last time I did, there were a lot of things going on right now. Is, in light of the fact that you started a new job, is now the right time to address these conditions ideally? Another example. Linda, you mentioned that you have 2 kids in college. I remember when we had kids in college and how much of a challenge that was in the household budget. With 2 kids in college, is now the right time to address what's going on in your mouth ideally? Now, what might the patient say, Darren? What might the patient say? Any of those examples?
They could say, you know what? This is the right time. Oh, no, you are correct. A few other things going on in my life. Why don't we
They could say, yeah, that's why I'm here.
Yeah.
Yeah. They could say, yeah, that's exactly why I'm here. Or, let's go back to my first example, George, the 60-year-old, lots going on in his mouth. George might say, well, as a matter of fact, we are up to our eyebrows with this move and lots of things happening. Here's what I'm going to go. If the answer is no, if the answer is yes, then we present optimal care. If the answer is no, which is another possibility, we say, George, totally understand. What I'm going to do is I'm going to break down your treatment plan into 2 categories. First category is going to be necessary dentistry, like things that need to be done right now that involve disease and decay. And then I'm going to work up a treatment plan for you to how to address these concerns ideally. One thing I would like to have from you is your commitment to regularly scheduled hygiene appointments. George, you have healthy gums. We've had a chance to evaluate that. You have healthy gums. That means that we'd like to see you every 6 months. And I'd like your commitment to, keeping those hygiene appointments every 6 months, because then I'll have a chance every time to visit with you during those hygiene appointments, to do a quick exam, to kind of give you a status report on what's going on. And then we'll be ready to do this when you are. We'll be ready when you are. George, how does that sound to you?
Sounds good.
Yeah, Doc, that sounds great. And I'm being sensitive to their timing.
Yes.
I'm also asking for a commitment. It doesn't mean they're going to be 100% committed, but they're likely. We know from Robert Cialdini, the world authority on influence, that when people commit to something, they're more likely to follow through with it. So, George, I like your faithfulness, your loyalty to show up every 6 months and give me a chance to keep an eye on things. I can give you a status report. If things start to go south, I can let you know. And we'll be ready when you are. And what we found is that lands so well on your patients, because instead of them hearing all or nothing,
right,
you never present all or nothing. You never present all or nothing. I want to be clear about it. I don't believe any of our listeners of the Private Dentistry Show present all or nothing. But that's what the patient can hear. And also notice the relationship-driven aspect of this. You're tuned into them. You're presenting dental solutions relative to their timing. Timing is a variable in case acceptance. And frankly, it's a variable you don't have control over. You have a lot of control over things, but you don't have control over timing in their life. That can change at the drop of a hat, good or bad. Timing can change good or bad.
Right.
And so now we're addressing that, and we're addressing it in a way that gives the patient the feeling of some control, and it tends to land really well with them. One thing I'm going to encourage you to listen for, you might be surprised how many patients will say, when you say, is now the right time to address this ideally, you might be surprised how many people will say, yeah, that's why I'm here. Ask the question, though. Ask the question for sure. One more comment before we get to the Q&A segment. One of the things I've noticed in practices that have been fairly consistent across almost all practices, doctor, as you mature and you age, so does your patient base. Typically, the patient base will mirror the doctor's age plus or minus 10 years. So, doctor, if you're 60, the sweet spot of your patient base are typically between 50 and 70. And that simply happens because of social circles and referrals and all kinds of things that contribute to that. There's exceptions, of course, but that's the common thing. So as you age, if doing more complex restorative dentistry is something you're interested in, the first thing you have to have is those skills on the shelf. And you've got to be able to provide those. You know, you're not going to present it confidently if you can't, if you're not confident of your clinical skills. There's lots of places to go to learn how to do that. I have a bias. I'm going to share my bias right now. I think one of the great places to go to learn how to do complex restorative dentistry is the Pankey Institute. Just go to pankey.org. There are others, and I'm going to give credit to some others. I think the world of what Spear Education does, Frank Spear and Spear Education, is very good. I also think the world of what John Kois does in the Kois Center, Kois Center, another great place to go. Hey, if you haven't been down to the Pankey Institute, come down to Key Biscayne, Florida, and learn how to do complex restorative dentistry. Dentists from all over the world come to learn how to do complex restorative dentistry, and that might be something you want to add to your skill set. Quick little story as I wrap this up. Longtime client of mine's, now retired, but as he got into his late 50s, he said, Gary, there's so many patients I have in my practice that have much more complex needs, and typically I just haven't done that in the practice. Do you think it'd be worthwhile for me at this stage of my career to learn how to do those skills? He was 57 at the time. And I said, yeah, absolutely. How long do you plan to practice? Well, you know, if I'm healthy, I'd like to practice at least another 10 years and maybe longer. I said, yeah, you got plenty of runway to do that. Go down to the Pankey Institute. Anyway, he went down to the Pankey Institute, took the essentials courses. Each one's a week long. And after going through the 4 essentials courses, was really skilled at adding complex restorative dentistry. And he spent the remaining time in his practice doing a fair amount of that, because a lot of these patients had been coming to him for years and they wanted to have this done before he retired. He ended up retiring at 70 years old. 13 years later, after he started that journey with the Pankey Institute. But in that last 13 years, he ended up doing a bunch of complex restorative dentistry. I hope that's encouraging, something for you to think about.